Thank you for joining us on GBMC's Facebook page. I'm your host, John Lazarou. This is the final of our 3 interviews today, focusing on COVID-19 and certain health issues that people are facing who might be at high risk for the coronavirus. I want to thank everyone for joining us today. This one will focus now on cardiovascular disease and COVID-19. And for those of you that might not have heard, according to the American Heart Association, it's been reported that as many as 40% of patients hospitalized for COVID-19 have underlying cardiovascular issues. Joining us right now to discuss the connection or the possible connection between heart disease and COVID-19 and what you need to know is Dr. Kevin Ferentz. Dr. Ferentz is the chairman of the Department of Family Medicine and lead physician at GBMC Health Partners Primary Care in Owings Mills. Dr. Ferentz, thank you for joining us today.
My pleasure.
All right, so we talked about COVID-19. Let's just start with some general questions about COVID-19. Just let's go over what are some of the symptoms of COVID-19.
So, first of all, the important thing to remember is that 80% of people who get infected with this virus have mild symptoms. They may not even know that they've been infected with it, or they may have cold symptoms or flu-like symptoms, which would be a fever, runny nose, sore throat, cough. People are talking about losing their sense of smell, losing their sense of taste. Sometimes people may have diarrhea, a little bit of loose stool, but overwhelmingly it appears to be presenting mostly as an upper respiratory infection in most patients.
So, unfortunately, most of the information that comes to us about people that have passed away in Maryland from COVID-19, there's been always that term with underlying medical issues. And a lot of them have been in the populace of 65 and older. So let's start with that segment population of what is the best advice you might have for people who are over 65 and dealing with this outbreak?
So it's very important. I mean, this social isolation thing that the governor has put forward and that the president has put forward is really very important. And it's important for all of us, but it's especially important for the elderly. Certainly over 65 is a reasonable number. It appears that most of the people who are passing away from this are actually even older than that, especially in Italy. A number of those people it's in a town that most of the people are over age 80. Unfortunately, as we get older, there's a good chance we're going to have some underlying medical problems. The biggest ones appear to be chronic lung disease. That's really the worst of all, because this is an upper respiratory infection, and if you already have a compromised lung and now you have to face this infection on top of it, unfortunately those are many of the patients who wind up being put on respirators relatively early on, and unfortunately many of them are unable to get off respirators. The other is underlying heart disease. Now, I know hypertension is on that list, but I think people who have well-controlled hypertension probably don't really have to worry too much. It's people who have advanced coronary artery disease, people who have had heart attacks, people who know they have blocked coronary arteries, people who have congestive heart failure. Those are the patients who really, really, really have to be very careful to not be exposed to this virus.
Okay. Now, let's say they are exposed to this virus. In what ways can they possibly, they might be affected by the virus for those people that have heart disease?
So I think those are people who need to get in touch with their doctors soon, and many of them are going to be seen by a cardiologist as well. They may want to let their cardiologist know. I think those are patients. Well, let me step back and say that for the overwhelming majority of patients, when we speak to these folks, and everybody's worried, so we get calls all day, every day. I think I got exposed, I have a runny nose, but I don't have a fever. And we do a video visit with the patient, and we look at them and say, do they look sick? And I know that sounds very simplistic, but a doctor is able to look at a person and decide whether they look sick or not. And when a person may not feel well, okay, but if I look at them and they don't look ill, then they're probably not seriously ill. I would want to know if a patient of mine had advanced coronary artery disease or lung disease, if they had been exposed, because I would want to be taking a look at them on a regular basis. And if at any time along the line it appeared that they were getting more short of breath, having difficulty walking around, or developed chest pain, that might be one of those times when we would tell them that they need to be evaluated. Not necessarily in the emergency room, but maybe come to the office first.
So that's when we flip away from a video visit to more of a one-on-one visit in
Correct.
a medical environment. Okay, one of the questions that came in before our program says that, look, despite the rapid spread and overall risk remains low for most people in our country, but the risk is higher for some groups. Should older adults with heart disease follow the same precautions that currently apply to everyone right now during these times, or should they take any additional steps? Now, you talked about the distancing and the isolation, but is there anything else additional that they could be doing?
I mean, other than not exposing yourself to someone who is potentially infected, that's really what it comes down to. I mean, my mother-in-law is an older lady living at home in New York. And she told my wife the other day, I'm washing my hands 1,000,000 times a day. Well, if you're not exposed to anything, you actually don't have to wash your hands 1,000,000 times a day because you're not going to be exposed to the virus. The other thing to try to reassure people is it's not just being in, you walk past someone who has the virus. It's unlikely that you're going to become infected at that point. It usually involves being in a relatively closed space for a relatively, significant period of time. And the person, it's spread by droplets, right? It's not spread by just the air that we're breathing in between us, which means that somebody has to cough or sneeze. And so if you're doing the proper coughing and sneezing into the crook of your arm, you're also unlikely to spread the infection.
And also, I'm sure with the distancing as well, that helps as much.
It certainly helps. 6 feet at the absolute minimum, 3 feet.
Let me talk about heart disease, because there are some people that have mild heart disease and some that have severe heart disease. Is the risk the same for both parties?
So at this point, that would be an unknown. That would be, I don't know. I would say anyone who has any significant heart disease, that certainly anyone who has symptomatic heart disease, someone who gets chest pain if they exert themselves, someone who has congestive heart failure, even if it's mild congestive heart failure, that would be a person who has to be really careful to not be exposed.
Joining us is Dr. Kevin Ferentz. He's the chairman of the Department of Family Medicine and also the lead physician at GBMC Health Partners in Owings Mills. For those of you watching, please submit your questions in the comment section. If you want to be a little more discreet, please feel free to private message us as well. Dr. Ferentz, one other question. I mean, we talked about adults with CHF, or congestive heart
failure.
Heart failure, thank you.
Yeah.
When you talked about special precautions that they should be taking, how about people that are taking care of someone who is or has CHF? What special precautions should they be taking as well?
Yeah, so that's really a very important thing, because they're going to have to take care of their loved ones, and it means that they're the ones that have to be washing their hands carefully. If they're outside in the real world, if they have potentially touched a surface that could have been infected, somebody sneezed on or coughed on. So the loved ones are the ones who need to be especially careful about trying to not get in touch, in contact with anyone, but also to wash their hands, use hand sanitizer to limit the amount of virus that they could be then bringing to their loved one.
So one of the things that a lot of people do, and I even do it myself from time to time, is check my blood pressure. Should people that normally check their blood pressure, let's say once a day, or maybe twice a day, I don't know. I mean, you'll tell us what are the proper protocols for that. But because of COVID-19, should people that check their blood pressure be checking it even more?
I would say it's only going to make them more anxious. I would say if you're used to checking your blood pressure once a day, keep checking your blood pressure once a day. Right. COVID-19 doesn't raise your blood pressure. Anxiety raises your blood pressure, but not the virus.
Does maybe having high blood pressure put you at higher risk for coronavirus or COVID-19?
So according to the list, it does. But again, I don't know if that's based on hard and fast data or it's more of a retrospective thing, that a whole lot of people who got admitted to the hospital or unfortunately people who died may have had high blood pressure. It doesn't mean that the high blood pressure is what caused them to die of the virus.
Now, before and with our previous guest, we touched up on fact versus fiction. So I'm going to read you this question because I want to, it's kind of a longer question, but I want you to help answer this one. Okay.
I'm ready.
There have been some reports about how certain blood pressure medicines might worsen symptoms of COVID-19. Okay. Should someone stop taking their medication now, just in case they get infected, and should they stop if they develop symptoms of COVID-19?
Yeah, this one's a really easy question to answer. So there's a lot of rumors. There's a lot of things that are flying out there that are not based on data. The blood pressure medicines that were talked about were the ACE inhibitors, which is a very commonly used blood pressure medication. The New England Journal of Medicine yesterday came out with recommendations saying that there's no evidence that being on an ACE inhibitor changes anything related to COVID-19. But I can tell you, if you need to be on an ACE inhibitor to keep your blood pressure under control and you stop it, now you're at increase of stroke, an increase for a heart attack. And so I would urge people who are on antihypertensive medications to stay on their medicine, or at absolute most, call their doctor and see what they think.
So that brings up a good question. Is there anything different that maybe even stroke patients should be doing right now, given what's going on, and anything that, I know exercise is important. We'll get to that in a minute, but anything different for even stroke patients?
No, people just have to avoid contact with folks who are potentially infected and do your usual routine as best as possible.
We talked about exercise, and exercise is part of that whole rehab program, right? Whether you're someone that's got some heart issues or a stroke survivor and so forth and so on. And, we talk about the social distancing a lot, going out, walking. Should they continue their rehab and as well take those special precautions that are aimed for everyone?
So if anything's happening in people's neighborhoods that are like is happening in my neighborhood, I mean, I have a dog. We have to keep walking the dog, and you get kind of crazy being locked up inside for a long period of time, and there's no reason why people can't go out and take a walk around the block. If you see someone, most of my neighbors are just walking to the other side of the street so that you're not in contact with them. There's no reason why people can't do that. And especially if they're involved in a rehab program after having had a heart attack or for whatever reason where they have to exercise, they can certainly go outside and try not to interact with other people, but do your regular exercising.
In our discussion, you're bringing up a lot of great information, for our viewers and those that will be watching this later on. However, I wanted to ask you, and I've asked the same question from our other guests, what are some certain sites that you trust that people might want to view at home? Whether it's someone that's taking care of someone with heart disease or someone who has heart disease, what are some good sites of information? You mentioned the New England Journal of Medicine, that's one, but I mean, that tends to be, very high end, right?
Yeah,
well, I'm sure the American Heart Association would be one. How about others? Are there other websites that have good information for those with heart disease and maybe even caregivers taking care of those with heart disease?
Yeah, that would be the first site that I would recommend, would be the American Heart Association. Now, I haven't looked to see if they've been putting anything specifically up related to COVID-19, but I've referred many patients over the years to the website of the American Heart Association because they have lots and lots of information, as does the American Diabetes Association. Those would probably be the main ones. What I would say is try not to get the information from your news station, because often there's some histrionics involved in that, and there's unfortunately a lot of bad information that's out there, and try to go to a more reputable source like the American Heart Association. The American Lung Association would also be one.
Because you mentioned earlier about the lungs and stuff,
yes,
that'd be another
the American Lung Association is an excellent website.
We talked about, and you said, going outside. I've seen certain people, when they walk outside, they wear the masks. What do you think about that? Should they be wearing masks? I mean, if they go to a public place and are walking around, like let's say a high school track, or I live in Columbia and we have trails that go through Columbia. What do you recommend and suggest on that?
I think it's probably unnecessary. I think that there's something that isn't being talked about a whole lot, which is, let's say you're wearing a mask and somebody walks by you, coughs and sneezes, and you think, oh, wow, that was great that I had this mask on, and then you take off your mask, and now you have COVID-19 on your hands. Okay, so it's taking masks off and on that can actually lead to potentially being exposed to the virus.
Joining us is Dr. Kevin Ferentz, Chairman of the Department of Family Medicine here at GBMC and lead physician at GBMC Health Partners in Owings Mills. I encourage our viewers, please send in your questions on the comment section, or if you want to, you can private message our questions as well. Dr. Ferentz, I want to harp on exercise because that's really the big thing. Those that have high blood pressure, hypertension, high cholesterol, even CHF or, heart disease, whatever, cardiovascular disease across the gamut, exercise is a big thing. we talk about walking, we talk about running, right? However, public gyms are now closed, right? Yeah. And you can only walk so much or run so much. So besides that, what are some of the other ways or other fitness to do, during this time?
People did exercise before there were gyms. I don't know if you know that. So,
of course.
Yeah, one of the biggies is stairs. If you happen to live in a place that has stairs, going up and down your stairs is a really, really good exercise for people to do. If you are in the backyard and there's a hill, walking up and down a hill just so that it's not boring. But I saw something on TV about a guy, I don't know what country it is, who did a marathon on his patio.
Wow.
Okay, I don't know how many times he had to go back and forth on his patio.
It's a long patio.
It was not a long patio, but he actually ran a marathon. Right. So I would say you can do kinds of exercises by lying on your back and doing cycling in the air. If you don't have weights at home, you can use your wife's pocketbook or something else that has way too much stuff in there, and you can do curls using things like that. If you don't have weights, there's always stuff around your house, and books.
And of course, there's always the push-ups and the sit-ups.
Absolutely.
And those kind of things. And yard work, right?
Yard work is good as things start popping out. There's weeds in my house. If anybody wants to come by and do some weeding, that would be great.
I will respectfully decline because you're looking at me and asking me that question. Okay. I want to talk about vaccinations and treatments. And this question came in. It said, although there's not yet a vaccine for coronavirus, how important is it for people with heart conditions to stay up to date on their vaccinations, such as those for pneumonia and flu? And there's a follow-up question to this. Can and should those with heart disease get their flu shot? Can they still get their flu shot, and should they?
Yeah, so actually the Health Department of Maryland actually put out a statement about this yesterday. We need to be immunizing people still against diseases that can be prevented with vaccine. The flu season is waning, but the flu season is still out there, and yes, you can still get a flu shot. Certainly, if you are a candidate for getting a pneumonia shot, you should be getting a pneumonia shot. It will help you. It doesn't prevent the pneumonia that's caused by COVID-19. That's a viral pneumonia, but it will prevent you from getting pneumococcal pneumonia. I want to take this opportunity to reinforce the issue of flu shots, okay? We're dealing with a virus that we don't really know a whole lot about. We know a lot about the flu. We know that every year in America, 40 million people get influenza, and about 40,000 of them die every single year. And as a family physician, I am always amazed when I say to a patient, it's time for you to get a flu shot, and they say, no, I don't get flu shots. I'm hoping that one of the good things that may come out of this COVID thing is that as people are clamoring to get this vaccine when it's ultimately available, maybe people will start to realize that actually you have a lot of risk of dying of influenza, and everyone should be getting a flu shot every year. It's a no-brainer, a no-brainer.
And we've spoken to a few of the infectious disease specialists here, and they even scratch their heads saying, everybody's clamoring for the COVID-19 vaccine. Here we have a vaccine for the flu, but yet people don't take advantage of getting the flu shot every year. And here they are yelling and screaming that they want, the COVID-19 vaccine.
It's a terrible thing.
It's fascinating, though, that, those are the same people that say, I'm not getting this, are almost the same people that are saying, let's get this thing going,
and
right?
I'm going to be using it next year to increase the number of my patients that get the flu vaccine.
Maybe a lot of physicians in your specialty will do that as well.
Actually, what would be nice to do is to pair the COVID-19 vaccine with the influenza vaccine. How about that?
That could be food for thought right there. All right. Treatment for virus infections, including COVID-19, typically involve rest and staying hydrated. Okay. If you have heart failure, could excess fluid in your body be an issue? If so, do these patients require extra monitoring?
So it depends on how seriously ill they are with congestive heart failure. It's usually not the fluid that's as much of an issue as salt. That's the issue. As long as their kidneys are working okay, they will usually be able to pee off the extra fluid. But if you take an extra salt, that makes you retain the fluid, and that would be a bad thing. So I would say people don't have to go crazy with drinking a whole lot of fluids, but we tend to tell people to drink fluids when they have the flu or a viral infection to help sort of pass the virus out of their system. Plus, drinking hot tea and also helps your throat feel better when you have a sore throat. But I would be careful to not overly hydrate if you have congestive heart failure.
Now, Doc, we were talking before the program that you're doing a lot of your visits now with your patients virtually. So those patients that are yours that have been diagnosed with, whether it be high blood pressure, hypertension, high cholesterol, CHF, what kind of questions are they asking you when they reach out to you, or maybe you're following up with them? What are some of the main topics that you guys find yourself talking back and forth?
Yeah, the overwhelming majority of contacts that we're having with patients now, unless it's like a routine scheduled follow-up visit, is people who have a cold, or people who have a mild sore throat, or people who have a runny nose. It's allergy season, okay? So everybody who is ill in any way, shape, or form just assumes that they have the vaccine, the virus. And, the overwhelming majority of people who have been tested so far don't have the virus, okay? So mostly what we're doing is hand-holding and reassuring that actually everything's going to be okay, that unless they have a fever or they start to feel short of breath in any way, they may have the virus, but it's not going to hurt them, and just to not worry so much. That's what we're trying to get people to do.
We're getting some good advice right now from Dr. Kevin Ferentz, Chairman of the Department of Family Medicine here at GBMC and lead physician at GBMC Health Partners, Owings Mills. We got about 5 more minutes left in our show, so I encourage our viewers, if they have any questions, please send them in the comments section, or again, if you want to be a little bit more discreet, you can private message those questions as well. Okay, I want to hit back on a couple things we've already covered, but I want to redo it again for re-emphasis. Blood pressure medication, aspirin, ibuprofen.
Yeah, don't stop anything, right? So that whole thing also with anti-inflammatory medications. It just like flew out there, but we live in a society now where information passes so quickly, and bad information, it's like playing telephone. One person says one thing and then another person says another thing, and by the time it gets to you, it's like it wasn't the original message at all. There is no evidence that taking an anti-inflammatory medication, if you get exposed to this virus, changes anything. So people don't have to stop doing that. Don't stop your blood pressure medication. That's going to hurt you much worse.
All right, so we talk about medication. How about diet? We were talking earlier with our chief of endocrinology, and for those that have diabetes, they have to follow a certain diet. For those that have heart issues, they have to follow a certain diet. So what are some of the foods that they should have in their refrigerator, or maybe on their fruit bowl, or in their pantry, or their snack drawer, that in this time would be good for them to eat? Because, we all eat a little more because we're stressing out, right?
Yeah.
So what's some of the good things that they should have?
And that's where I was going to go. My most important thing is decreasing your calories, because I know I take care of a lot of patients with weight issues, and there are a whole lot of people calling me saying I'm really having problems because I'm gaining weight. So people need to be avoiding calorie-dense foods, which is mostly fatty foods. So when you're at home, fries and burgers shouldn't be the things that are on your, and I know that the burger places are having these wonderful commercials. We'll be happy to deliver you your burgers without any charge. Well, you pay a price for that down the road because it's too many calories. We should be eating lots of fruits and vegetables. We should be eating plain pasta. Those are good foods, low-calorie kinds of foods.
Okay, so we hit medication, we hit diet. Let's hit exercise one more time. Continue to exercise, right? Just be cognizant of the social distancing, correct?
That's exactly it. If you're walking outside, if you have to walk your dog, or you want to walk around the block, just if a person is heading towards you, walk to the other side of the street. There won't be any issues unless the person walks up to you and sneezes in your face or coughs in your face. The likelihood that you're going to get exposed to the virus is about 0.
There's been a lot of people that before all this happened that had registered for certain 5Ks and for certain 10Ks and maybe in half marathons. And, I myself had registered for a 10K, in Colombia, but I continue to train as if that 10K is happening. I continue to follow the regimen, and the day of the 10K, if it doesn't happen, I just might run a 10K myself. Do you still suggest that people be as committed to their exercise now as they were before COVID-19?
100%. I think we need to try to lead our lives as normally as possible given the restrictions that are in place. But it doesn't mean that you can't be running if you're a runner. My son is a half marathoner. I think if we told him to stop running, that would be the end. So yes, he is running, and it's okay to keep running.
If you told him, he'd probably like, who abducted my father? Okay, before we finish, what are some final thoughts and tips you would like to share with those who've been diagnosed with any cardiovascular issue regarding COVID-19?
I would say the most important thing is just be careful about not being exposed to the virus. Even if you have an underlying condition, it doesn't mean a death sentence if you do get exposed to the virus. We're just going to keep a much closer eye on you. And that at this point, it looks like about 20% of people who are exposed to the virus get any significant illness at all. And of those, about 5% get seriously ill. So if you do have underlying cardiac disease and you do wind up having a more problematic issue with the virus and you have to be in the hospital, it still doesn't mean you're not going to recover and be just fine.
You know, I wanted to touch base on one other aspect of the populace that we neglected, and those are our frontline healthcare workers, you know, the people that work in the ED, that are physicians and stuff. You know, they too have certain underlying health conditions as well, and some of them may have cardiovascular issues. What is your recommendation, suggestion for your fellow colleagues that are seeing patients that might have some certain heart issues themselves?
So I think in those situations, that's where personal protective equipment is important, and we need to use more of that as much as possible. Wash our hands. Try not to be exposed to people who are coughing and sneezing, and they're smart. They know what they need to do to avoid the exposure.
And one final question before we go. You mentioned earlier some important websites for people to visit if they need information, whether you're a caregiver or someone who has, heart disease. Can you just repeat those one more time for our viewers, just so they can have it in case they have any questions?
Sure. I think for heart disease, going to the American Heart Association's website, and for lung disease, the American Lung Association. And I would urge any smoker at this point, just in case you were to get exposed, smoking is definitely a risk factor, and anybody who's still smoking should be stopping smoking during this terrible time.
Plethora of great information from you. Thank you, Dr. Kevin Ferentz. Dr. Kevin Ferentz, he is the chairman of the Department of Family Medicine at GBMC and also lead physician at GBMC Owings Mills. For those of you that are watching our show, if you have any questions, Dr. Ferentz will stick around for a few minutes. Please submit them in the comment section, and we'll get to him before he runs out the door to get back to his patients. I want to thank everyone that has joined us today on Facebook, and those of you watching, whether you're at home or at work, we really appreciate it. All these 3 interviews that we had today will be posted later on our Facebook page and also our YouTube site that you can go and visit and watch at your leisure. One thing before we go, I just want to give another reminder about an important event taking place on Saturday, April 4th. It's a virtual event. We're trying to be respectful of the social distancing and not having more than 10 people in one place. It's for the GBMC Walk a Mile event to help raise funds for the GBMC Safe and Domestic Violence Program. I've said it so many times today, I'm just getting tongue-tied. It's a very important program. We have helped over 700 patients, actually 725 patients in 2019, which if you come up the main entrance of GBMC, you'll see 725 butterflies in the field. We encourage anyone who is interested, because it's a virtual event, you can walk anywhere. And we talked about the importance of exercise, whether it's around the track, whether it's on your balcony. If you can do a mile, we would greatly appreciate it. If you're interested in participating, it is not too late. You can also donate if you would like, so please visit gbmc.org/walkamile. Again, on behalf of myself and all the physicians that participated in our interviews today, I thank you, and I hope that you stay healthy and stay safe.